Thank you all for joining us tonight. We are going to wait just a few more minutes for others to join us, and then we'll get started. Welcome to Family Houston's weekly Facebook Live series. We're here every Thursday night at 7 o'clock p.m. You can find out more about Family Houston and some of the topics we're covering, as well as watch our past live streams here on our Facebook page. We hope you'll continue to join us each week. Tonight, we're going to be discussing essential workers and their families. And first off, we just want to recognize all of the essential workers who have been working so hard over the last months. We are incredibly grateful for you. Tonight, we will be hearing from a frontline doctor on how telehealth services might look in the future, how the families of essential workers are being affected, and tips on how to manage some of that stress they're facing. So I'm Shelly Long, the Manager of Communications at Family Houston, and I'll be the moderator for tonight's session. I hope you have been tuning in over the last month and know a little bit about Family Houston by now. But if you haven't, we provide mental health counseling, financial and employment coaching, and case management services to individuals, children, and families throughout the greater Houston area. Our counseling services are offered on a sliding fee scale. We accept most major insurances and Medicaid. And both our case management and financial coaching services are offered at no charge to the client. So if you or someone you know could benefit from our services, you can message us here on Facebook or you can call us. And I'm going to drop in our contact information in the comment box in a little bit so you have that if anyone needs it. And tonight, to get started, I am joined by Marcia Feynman, who is a Family Houston volunteer counselor, as well as her husband, Dr. Feynman, who is a board-certified gastroenterologist doctor, and our very own Vice President of Behavioral Health Services, Jessica Cisneros. So thank you all for joining us tonight.
Sure. Happy to be here.
Yeah, happy to be here.
So I'm going to start with asking Jessica a question here. So Jessica, who is our Vice President of Behavioral Health Services, she's also a licensed professional counselor supervisor. So again, Jessica, welcome to you. And thank you for taking time out of your schedule tonight to talk with us.
Thank you, Shelly.
So Jessica, do you think maybe you could talk a little bit about some of the stress essential workers and their families might be facing during this time?
Sure, I'd be glad to. I think first off, we want to thank, like you said, all of the essential workers out there. We really couldn't be doing this without you. But I do want to talk about some of the stress that they are facing. I think essential workers are facing quite a bit of stress. This pandemic is really affecting people in ways that we never imagined. Just knowing that, you have to balance life in a total different way, as well as deal with a lot of new anxiety and fear that is coming about because of the pandemic. We definitely know that there's just a lot going on, and we want to be here for our essential workers.
Thank you, Jessica. So I'm going to actually jump over to Marcia now. And Marcia and Dr. Feynman, feel free to pop in if you want to. So I know you're an essential worker and your husband is that essential worker, and you're also a parent. So I'm imagining that's a lot of stress that you're dealing with right now and trying to balance. Do you think maybe you could talk a little bit about how that's affecting you and your family and maybe what some of y'all are going through?
Sure. Keith is actually not working in the hospitals, but he is doing procedures. So we do have the aspect of him using PPE equipment and having to go in and do procedures on people. The kids have been doing online schooling, as everybody's children have, and it's been very difficult, I think, for these kids for a lot of reasons. Shelly, I'm not sure if this is where you want me to speak about this issue or just talk about our stress. We right now have the kids doing online learning, as I said, and they're doing great. They seem to be doing really well. But I think that the complete change of environment, they aren't seeing their friends every day. They're not seeing their teachers. When they are, it's on a computer screen. Their whole life has been completely disrupted. And I think that Keith is doing telemedicine from home now, and that is a big change. Usually, we don't see dad till 7 o'clock at night, and now he's having lunch, and we're all on top of each other. And I think it's stressful we have twins and they're 10. I think it's stressful for them to have to be doing school with their siblings, which I think is happening everywhere. And then the kids, they have friends that don't have siblings, and then the parent is having to be the friend and teacher, and it's hard on everyone. And I think that our kids have been doing remarkably well. But I will say that being that I'm a therapist, I try to see what's going on. And I think as parents, having any kind of psychological background or not, it's important to really talk to them about how they're doing, how this is so weird. Isn't it weird to have dad here? Isn't it weird that you're not at school? How do you feel about that? And a lot of times they'll say, and plus they might be walking by when you're listening to the news. I've become obsessed with my 6 o'clock CNN newscast. So normally the kids aren't hearing any news, and now they are. And
it's scary. It's a lot of scary news.
Like this many deaths, 70,000. Then my daughter, the next day my daughter will say, well, that's 3,000 more deaths than yesterday. And so I think it's really important to check in with your kids, to let them know it's okay to talk about being scared. I will say with my daughter, they both have been, we're fine. And then one night, I don't know about other parents, but I think kids, after a bath and they're getting ready for bed, they're a little more relaxed, and I think they're a little more open to their emotions. And she said to me that she was scared, that this was scary. She was scared. Daddy's a doctor. She has friends. We have one friend that they haven't seen their dad since March. He's been living in an apartment, and
he's afraid to go home. He's afraid to bring the virus home and spread it to his family. And so to keep his family safe, he's taken an apartment near the hospital, and he's essentially put himself in isolation because he's taking care of so many COVID-19 patients.
And so she talks to her on Skype. And so there's, it's not just what's happening in your own family. If everybody's kids are communicating with their friends through Skype or FaceTime, and these kids are all talking, and they're all talking about this, and they're all talking about all this different stuff. And so I think it's important to, check in with your kids, make sure your kids feel safe to talk to you, make that, if you present as you've got this, you can handle this, then your kids' anxiety will go down.
Yeah,
I think those are some really good points. Oh, I just cut you off, Dr. Feynman. I was actually going to ask if you wanted to kind of touch maybe on some of the things you've maybe seen with some of your friends or coworkers who have been on that front line. And I know you started to touch on that. So maybe if you want to talk a little bit about some of that and what people are seeing.
So one of the things that's been dramatically different with the way that healthcare has been delivered now is that patients in a hospital, especially the really sick patients, have been completely isolated and not allowed to be with their families. And most of the big hospital systems, in order to try to protect patients' families from being exposed, have not allowed visitors. And when patients have been critically ill or even are dying in the intensive care unit, they've often been alone. And that has been something that's been unexpectedly difficult for the healthcare workers. The nurses, the doctors, particularly the nurses, have often been the only person there with a patient who is at the end of their life. They can't be with their family, they can't be with their loved ones. And just having somebody there to hold their hand or talk to them, in their last hours or minutes is something that I don't think anyone really expected to have to be part of caring for these people, but it's become a critical part, and it's been extremely difficult and stressful on a lot of the healthcare workers to deal with this, that the support systems that patients would ordinarily have just haven't been able to be there, not because the families don't want to be there, but because they're not allowed to be there. And that's been very stressful for a lot of people within healthcare.
I can't even imagine that. And I think that's a good point you make, that a lot of people are having to really step up in ways that must be incredibly difficult for both the family and themselves. So you kind of mentioned how services or healthcare services are different right now. And I also know you've been doing some telehealth services. So I know you can't answer definitively, but what do you think we could expect for telehealth going forward? And maybe what are some pros and cons you've seen using this new technology?
Well, we're hoping that the government will allow us to continue to do this, especially for the more vulnerable patients, the older patients, the patients who are chronically ill. I think it's been a godsend for the patients who find it challenging to get transportation right now, for the patients who are scared to come to a doctor's office, especially the doctors who are located at hospitals. A lot of physicians have their offices adjacent to the hospital, and patients really don't want to go there and they're scared to go. And for those patients, I think it's been great. We're finding that much of the healthcare that we deliver can actually be delivered by a video conference, and certainly things like medication refills and routine follow-ups of medical problems. A lot of that can be handled without the need for an inpatient visit. Certain things can't. I mean, if someone calls me and they're having abdominal pain, I can't really evaluate that well over the phone. And when we couldn't get any tests done, that was very difficult and challenging, and I was afraid that we would be missing things. But now we are bringing those patients into the office, but I think that the telemedicine ideally will be here to stay. The problem is that the government has to make a decision as to whether they're going to allow it to continue going forward. I think a lot of doctors are hoping that they do.
That'll be interesting to see what kind of ends up playing out here. Jessica, I'm going to hop over to you. So I know, you're a therapist and you're kind of working in this field, but I kind of think your expertise could also kind of play into all these other essential workers who are helping people, grocery store workers, transportation workers, bank tellers, all these people who are front line that we may not think about. But maybe you can talk about some of the ways you are feeling being in this role, and maybe we could maybe understand how some of these others are kind of feeling right now.
Sure. Definitely. So first off, it's always an honor and a privilege to be able to work with clients and be able to serve them. And I think when we first started offering telehealth services during this pandemic, it was a little overwhelming. I work with a staff of 23 other individuals, and everyone was kind of facing anxiety. Like, what am I going to do? I'm feeling anxiety. How am I going to help someone else? And so talking through that, holding several meetings with our staff, motivating each other, reminding each other of our training, of our expertise, it went a long way. And as soon as we started providing the services, we realized how important they are to our clients. And so I would say, although, there's different fears and anxiety that everyone's living, making sure that we know why we're here, the work that we're doing is going a long way for our clients.
That's a really good perspective. And hopefully other people can kind of recognize that in these other industries that they're working in. I'm actually going to keep both of you guys up. So I'm going to pull Marcia up because I think maybe both of you could provide some insight for me onto this. Marcia, why do you think counseling is important for everyone?
I'm trying. Well, I think that counseling gives people the opportunity to talk to somebody who's not in their circle, right? So for a teenager, sometimes it's difficult to talk to parents about important issues. And for adults, married individuals, it might be hard to talk to a husband or wife or partner if you're in a relationship with the partner. And therapy provides a safe place. And if you live by yourself and your family isn't close by, you're not in contact, therapy is a place where it's safe. you can talk, you can present your true self, and nobody is going to judge you. And I think it really helps to talk things through with somebody who doesn't know you the same way your family and friends know you. And I think it gives you a perspective that maybe you wouldn't necessarily see. And I've worked with a lot of adolescents, and I think it's been a huge, if they really use it well, it can, I always say there's a path they may go on, and it might be this path, but if you can help them with therapy, they can go on this path. I know it's kind of weird in a Facebook Live but you have this opportunity to really help somebody shift. And so that's just with adolescents, but I think with everybody, and particularly now, this world is so scary. There is a pandemic. There is violence everywhere. There is so much going on. These kids and families have to deal with things that I never had to deal with growing up. And nor did, my husband. We're older, and it just, it's a different world, and it's so stressful.
One of the things that we've seen within healthcare has been that the fear that people have is causing them not to go get care for their regular medical problems, which has been a big problem. There are patients, I've heard stories of people having heart attacks at home because they were afraid to go into the emergency room because they were afraid of getting exposed to COVID-19. And the end result is that you're going to see people whose lives are going to be ruined or severely altered, even though they don't have the virus, just by the fact that the virus is out there. And the fear that's pervasive, I think, in the community right now is something we've never seen it. I'm old enough to remember when AIDS was first starting to explode, and that was never quite the same as what we're dealing with now. There wasn't that level of fear in the community. 9/11, unless I think maybe you were in New York City, there wasn't that level of fear that there is now. I think there's a level of fear in my lifetime.
It's also, I just want to interject, it's not just COVID, it's, employment. Everybody's losing their jobs, or if they have a job, they're not getting paid as much, or they have a business, or their hours got cut. And, Family Houston is a great place for people. It's a sliding scale, and it really gives people the opportunity to have the ability to go and get counseling, because sometimes counseling, if you have a private therapist, it's expensive. And there's Family Houston, there's other agencies, but I think there's like everything together. It's like imploded, right? You've got COVID, you've got employment, you've got elderly. It's massive. And I don't even think you can compare anything that we've had except maybe the Depression or World War II, which is before our lifetime, thank God. But I think that we're on such a different scale. Personally, that's my personal opinion. I don't know if that was helpful.
Mm-hmm. It's very helpful. It's very helpful, and I think you both hit on very important points. As far as counseling being important to everyone, Marcia, I think you did a great job of explaining that. And I think one more thing that I would add to that is that it's a place when you go to counseling where you can be vulnerable. You mentioned a safe place. We also need to talk about how confidential it is. It's, we're doing it through telehealth, and we ask clients, if you're going to agree to do telehealth, we ask that it be in a confidential setting so that you can open up and be as vulnerable as possible. And it's the one place that you can talk about anything and not be judged. There's no shame that goes along with this. We work through anything that's going on, those fears, that anxiety. We don't want those fears to prevent you, like Dr. Fineman said, from getting healthcare. There's a lot of need, and we need to make sure that we continue what I would say is self-care, right? Seeking what we need to be living in and existing in a way that is somewhat normal, even though we're in an abnormal situation.
Thank you guys all for weighing in on that question. So Jessica, I know we kind of talked a little bit about maybe what some of these frontline and essential workers are dealing with, but maybe you could touch a little bit on, besides seeing a counselor, some things they could do to maybe try to alleviate some of the stress.
Sure. So one major thing that I would start with is make sure you're following CDC guidelines, right? You know, do everything of the basic. Wear your masks, wash your hands, be careful. I would say let's try not to get into our heads and get too obsessed with situations, because that does affect us quite a bit. If we start panicking too much, if we start obsessing about the virus, about the germs, it just can become very overwhelming, and then we can't think. We know that when anyone is stressed, you're not able to think as clearly. And so, you know, things that help with relieving some of that stress, trying to do, you know, new hobbies, you know, what's maybe going outside for a walk, picking up a new hobby that you can do in your home. Just self-care. I mentioned it a few minutes ago, but I would say really focus on exploring what would I enjoy right now. I know that I'm not able to go out. I need to social distance, but what can I do? What's in my control? And like you said, you know, yes, of course, counseling is definitely always an option, but there's other things that you can do. A lot of the videos that have been shown from Family Houston talk a lot about different coping strategies that you can use in your own home, talking to your kids, really taking this time to connect with your family members, maybe even calling a friend, looking up things online, watching a movie. There's so much that can be done. Yet if we start thinking about everything that can happen, it can get overwhelming. Also, the news is very important, but if you feel like that's overwhelming, I would say limit the amount of news that you're watching or the articles that you're reading. That's extremely important.
Thank you, Jessica. And I'm going to have all of you guys back up here. Is there anything else that you guys want to share that maybe you didn't really feel like you got to touch on at all, whether that be mental health related or physical health or anything else that you've been seeing? Just feel free to jump in.
Well, just a couple things to follow up on what Jessica was saying. I think exercise is also important. I know it's getting really hot here in Houston, but getting out and taking a walk. I know personally, there were a couple days where I didn't even I realized I hadn't left the house between just doing different stuff and not, you can't, you know, that's not great for your mental health either. The other quick thing I wanted to say is one of the things to really look out for with your kids is, you know, the profound effect that this whole time is having on the development of children. And that, you know, that is getting stayed in a lot of these kids. You know, preschool kids, social interaction is a huge part of their learning and growing. And even with older kids, they learn from each other, they connect, they learn how to navigate, negotiate social issues. And so just to really, as a parent, be aware of that and keep an eye on that. You know, and some kids are having a more difficult time with online learning. Some kids who have attention issues, you know, this is very burdensome for them. And then it's stressful on the parents and so forth. So it's just something as you, if you have kids at home, to really look for.
Yeah. Well, the other thing is I've seen is that a lot of young people post-college are in a situation they're not living with family anymore, but they may have lost their job or can't find a job, and it's isolating. And these are people who are used to going out to restaurants and bars and meeting people, and you can't really do that right now. And so the world has kind of shifted under their feet. And I think it's important to try to keep up the personal connections, you know, getting on Zoom calls and things like that with friends from high school. And you know, I've reconnected with some people I haven't talked to in decades. And I think that's been a way to keep sane during this time. And I think it's really important to keep those personal connections.
And group Zooms, like I'm sure everyone has done, like, you know, my college roommates who we were all over the country, we had a group Zoom on Sunday was fantastic. And, it is reach out to those people. And most everyone has FaceTime or Zoom is free for 40 minutes. So that's a way to do it. And I just think as, parents and just as individuals to kind of watch your kids and watch yourself and watch what's going on inside and watch if your kids are subtly changing their behavior, and notice, yourself, if you're subtly shifting behavior in any way, to kind of be aware of that, because it's a slippery slope, right?
Yeah. Jessica, did you have anything else you wanted to add?
No, I think that self-awareness piece is extremely important. Thank you for touching on that, Marsha. I also want to thank both of you for being willing to let us into your home and share this. This is extremely important to our community. Thank you.
Well,
Yeah, thank you both.
I think what Family Houston does is incredible, and it's just a wonderful organization. And I think it's, we need Family Houston and places like Family Houston even more now, because people are going to need the access to mental health and case management, all the other things that they do, that everyone does.
Thank you.
Yeah. Well, thank you guys again. And so to everyone who was watching, thank you guys for tuning in. I hope you all learned something tonight from our guests of Marsha Fineman, Dr. Fineman, and Jessica Cisneros. So again, if you have any questions, please feel free to reach out to us. We're here for you guys. Thank you.
Thank
Thanks,
you.
good night.
Good night.